time?
Yes. Hi.
And
She's ready to go. Okay. Thank you all for coming. I'm going to be talking about the influenza or the flu shot, both interchangeable terms. Okay. Now, this is a little visual aid, kind of give you an idea of what I'm talking about. The purpose today is to just give information. Okay. So, first thing, thousands of people die every year from influenza or the flu. The CDC, Center for Disease and Control and Prevention, the website has a lot of information, and I pulled most of the information off of there about the flu shot. And the numbers start at about 2,300, the lowest year, up to 49,000, the highest year of deaths related to the flu and complications of the flu. Sometimes people get the flu and then they get pneumonia and different other complications, which could lead to death. So hopefully none of you will experience that this year. The next thing is people who work in the healthcare field, oftentimes the employer will mandate that they get the flu shot. There was a study done by the NIH, National Institute of Health, that in Canada, in 2009, this was published in June 15, 2009, 40 to 60% of healthcare workers in Canada, that was the rate, about 40 to 60%. In the United States, 90% of healthcare workers get a flu shot because their employer asked them to get it and usually supplies it. And now, if you do get the flu shot, you could have some irritation at the insertion site. You could have, some redness. You could feel icky for a couple of days, but it is nothing compared to if you actually get the flu. So, I would say the benefits, they outweigh if you get the flu. So it's worth it. Now, let's talk about how the flu spreads. In this picture here, you see a person that's sneezing, and it's spread through droplets. And the thing about the flu is you can catch it up to 7 days before the person starts to feel ill. So you might have the flu and not really know it. So it's possible to spread it before you actually start feeling sick. Unfortunately, that's just the way that it is. So when you do start feeling ill and you start having symptoms, you should cover your mouth, your nose if you cough or sneeze. If you get sick, you should stay home. You shouldn't go out and spread it to other people. Millions of dollars a year from people who lost work, hospital stays. The flu costs so much money from people who spread it around, and they really should. So hopefully that won't happen with you guys. Okay, now, as far as every year you could get the flu shot, but you could still possibly get the flu. Because every year, the flu shot only covers certain strands of the flu. So it's possible for you to get a shot and still get the flu, depending on what strand it is. A lot of questions about the flu are, if I get the flu shot, will I get sick? Or will I catch the flu? None of that is true. But you might not feel well if you do get the flu shot, but that's not the actual flu. Because the vaccine that we actually get, it's not a live vaccine. It's called an inactivated one. So, other than that, some things you should do to stop spread, what we already talked about, is covering your mouth, your nose, get the flu shot every year. Also, wash your hands often and stay away from those that might be ill or have it. Sometimes if your family has it, it's not much you can do about that. But again, unfortunately, the flu We just have to make sure.
People will still.